What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. In this video today, we're going to be talking about military versus civilian pay, who makes the most money, and I have a special guest who's going to tell us a little bit about the military pay as a physician, some of the pay structure and how it all works on how physicians get paid in the military. Dr. Bradley, how are you doing today, man?
I'm good, Dr. Webb. Thanks for having me on.
Yeah, absolutely. Go ahead and introduce yourself and tell the viewers out there who you are and kind of what you do.
Sure. My name is Steven Bradley. I'm an anesthesiologist by training. Currently on active duty in the United States Navy, where I'm an anesthesiologist as well. I work at one of the larger military hospitals. So there is a residency program, so I do some educational opportunities and teaching with resident physicians.
Awesome. So you've been in the military for how long?
2 years now.
Oh, 2 years. Okay. Yeah, I'm interesting to see, kind of hear your perspective about your experiences in terms of pay, because, a little bit about background about myself. I went into the military at age 17 and did 8 years in the Air Force, enlisted on active duty, and decided not to go back in as a military officer after I completed medical school. Real quickly, just because I figured the amount of loans that I had, I can pay them off quicker than that time that I would have to serve in the military. What are your thoughts about that versus someone taking on a crap ton of loans versus having the military pay for them?
Yeah, my thoughts are, first and foremost, if you are in that position and you're thinking about making that decision, you really need to find somebody in the military to sit down and talk to you and walk you through it, because there are a million different options of how it can turn out. There's three main programs. The Health Profession Scholarship Program, which is very common, that covers tuition for 4 years of medical school. And then there's your payback time. There's a Financial Assistance Program, which I did. That's once you're in residency, where they give you a stipend of $45,000 a year and $2,000 a month. This is taxed, so my $45,000 check was actually like $37,000.
Good.
And I got that for 3 years, so I owed 4 years. Then there's a direct accessions program where you come in after you've done all of your training. And the difference between paying loans out of pocket and having the military pay for your loans, if that's your only option, obviously, it's something to definitely consider. But you want to look at your goals. What specialty do you want to join? What style of practice do you want? Do you like the idea of being in the military? Those three things you need to think about before you really think about the dollars and cents.
So I definitely agree. It depends on your specialty choice. If you decide that you want to go into emergency medicine or internal medicine, family medicine, or pediatrics, the pay between military and civilian, I would imagine, is pretty comparable, versus if you go into like neurosurgery, orthopedic surgery, the higher paying specialties, plastic surgery, it's probably better in terms of salary as a civilian. Is that kind of correct?
Absolutely. In addition to that, so you could take your family practice or your pediatrics, which for whatever reason are some of the lower paying specialties, relatively speaking. Sorry, I'm fairly blunt. I'm not super politically correct. But in the military, an outpatient pediatrics may run, 150, 200,000 for salary. In the military, you can get fairly close to that with depending on how long you've been in service.
Gotcha.
Along with that, one of the ideals for family practice and pediatrics or other specialties, even surgery, if you don't like practicing medicine, there's a huge range of leadership opportunities, what's called austere medicine, or where you deploy and go forward, and you're working with groups of Marines or on a ship, and you're doing things like a CMO would do. You're kind of the physician leader for that organization, which is really get you out of that scope of practice as a pediatrician or a family practice doc. So some people really gravitate to the military for those reasons.
Got you. And did you sign up for the military prior to med school, and then you got the stipend all throughout? Because, living on a the loans as a med student, most people would be, struggling in med school to pay for their bills and do things like that. But I imagine with a stipend, that probably helped you. You had a little bit more money than most of your other classmates.
Yeah, so I actually applied to the HPSP program, which would have given me money in medical school, but wasn't accepted. So I ended up doing medical school, and then when I was in residency, I joined through the FAP, where they gave me that bonus money and stipend. My reason for joining is my dad is a retired naval officer, and my little brother's in the Navy as well. Mm-hmm. So it was a family commitment for me, and that is the reason that I joined.
Gotcha. All right. And, with everything going on with COVID, especially, being in private practice, and I'm about to enter private practice, it makes me a little nervous just because you don't have that, that guaranteed paycheck that's going to be coming in. And then what a lot of people don't know about, they don't teach us and they don't talk about this, is like overhead. And then most groups that I have interviewed with recently, overhead can be anywhere between $30,000 to $60,000 plus a month that you have to pay before you can even take anything home. So, your bottom line, you have to make more than, let's say, $50,000 a month to bring anything else home. So, there's private practice, and then there's being in academics, or there's, being in an employed position where, your salary is pretty much set as long as you meet some criteria in terms of, number of patients or number of surgeries. But if you're in private practice, that's why a little nervous for a lot of these small groups out there, because, they have to meet that overhead, and they can't meet that overhead. A lot of these groups are going to close. But in the military, that's something that you don't even think twice about, like paying your light bill and your employees, your paper, your EMR expenses, your billing, all those things. So I guess that's a plus, especially.
That was a huge huge perk, especially with COVID-19. Because I think even some salaried positions were getting pay cuts from the stories I heard. In the military, we were smoking and joking, not to make light of the COVID pandemic, but our pay was completely unaffected by what was going on with COVID. It was one of the first times I was looking around like, man, I'm in a pretty decent spot.
Yep.
And then for us, a little different viewpoint, because some of us were getting deployed for different missions to help support the COVID-19 response. I got pulled off of and put onto several different deployments in a short period of time, but I ended up staying at my hospital, and we ended up working almost part-time because the operating rooms were closed for only urgent emergent cases. So the COVID-19 pandemic was a very different experience for me as a military physician as opposed to a lot of my counterparts.
Yeah, I would probably agree with that. All right, so we're going to jump right into, I wanted to share my screen into an article that just came across. It's the 2020 Medscape. They do this every year. This is their 10th annual survey that they did. They interviewed over 17,000 physicians and over, I think, I don't know how many specialties, but it's a lot of physicians, and they asked them, how much do you make? What bonuses do you get? About their lifestyle. And we're going to go through this really quickly, but in terms of COVID, practices have reported a 55% decrease in revenue and a 60% decrease in patient volume since the beginning of the COVID crisis. 43,000 healthcare workers were laid off back in March of 2020. 9% of independent medical practices report that have closed their practices, at least temporarily. So that's a large percentage of people. You can imagine trying to pay all of your employees, your overhead when you can't operate. Like in most parts of Texas now, we can't do surgery unless it's like a trauma or a really urgent case. So that makes it really, hard and challenging to meet your overhead. So this is what groups are kind of going through during this times. But in general, as a civilian specialist, on average, out of these 17,000 physicians that they surveyed, the average is around $350,000. For PCPs, it's almost $250,000. And then Dr. Bradley is going to go over kind of what the average for military physicians. The annual average compensation, orthopedics and plastic surgery, ENT, their cardiology, they're the ones usually at the top. One thing that they they really never have on this every year is neurosurgery, which I imagine neurosurgery would be above orthopedics. So the average compensation for orthopedics, this is $500,000, and also depends on where you're located in the U.S. That does not include any ancillary incomes that you make. A lot of physicians invest in surgery centers, different DME equipment, MRI. So there's lots of ancillary income. I actually just spoke to a surgeon the other day who said he makes 4 times as much in his ancillary incomes than he makes as a surgeon. So and that's how a lot of people can make a lot of money in private practice, but you have to deal with everything else that goes along with that during the COVID pandemic. You're trying to meet your overhead and quotas and things like that. So, Dr. Bradley, you want to talk about the military kind of pay? How does that usually work? When someone joins the military as a physician, how do you get paid, and how much is that usually?
Yeah, so you can pretty much just cut half of whatever you saw. But I'm kidding, but not really. So I had no idea when I was coming in how much I'll make as a physician. I didn't know who to ask, who to talk to, or how to figure that out. Since being in for about 2 years, I finally kind of figured out how I can break this down, and it's all available online. Mm-hmm. So this first chart that Dr. Webb's pulled up here is the base pay. For the military, we get a pay stub. We get paid twice a month, on the 1st and on the 15th. And our salaries are broken down by several components. There's a base salary that is based upon your rank and how many years you've been in service on active duty. There is the BAH, which is base allocation for housing. There's the BAS, which is base allocation for sustenance. That's a food stipend. The BAH, which is housing and your food, are not taxed. So that's nice. For physicians and other healthcare providers, there is a specialty bonus as well, which I'll touch on. And then there's other perks that I'll touch on at the end. So, for example, the chart that Dr. Webb's pulled up here, in the very top box there, it says 2 years or less through over 8 years of service. So I have been in just over 2 years. I usually don't let people into my pockets, but it's really all online. So you could look it up if you knew like 2 things about me anyways. So if you go over to the over 3 column and then come down to 04, that is, the over 2 column, and go to 04, because that's my rank, which is Lieutenant Commander. The monthly base salary for any Lieutenant Commander in the military is $5,770. For a little bit of context, my dad retired at 21 years of service at the rank of 04.
Okay. So he would be down here.
It takes, quite a bit higher. Yep. But it takes other people in other communities that are real military, that drive ships, that fly planes. It can take them 16 to 20 years to make the rank that I made in 2 years. So they do give you a bit of a chip shot for becoming a physician. So the base salary for any military position would be $5,700 if you're a lieutenant commander or a major in the Army. I think it's a major in the Air Force as well. Over 2 years of service. So that's the base salary. The next two, I don't think I gave you the chart for, but base allocation for sustenance is the food stipend. Mine's about $250 a month. That's untaxed. Good. My base allocation for housing, this is dependent upon where you live. So if I plug the numbers for DC, I'm not in DC, but I ran these numbers a while back. You get $1,700 a month as a housing stipend in DC, and that's untaxed. If you have a wife and kids, or you have dependents, then that affects your allocations for sustenance and housing, so it goes up a little bit. Gotcha. The next chart, the next tab that you have there, Antonio, goes over the bonuses, right? So you're a physician coming into the military. How much do you make? So that first chart in medical corps, it says general medical officer. This is if you're not specialized. A lot of general medical officers in the Navy are primary care docs on ships. They've only completed an intern year. They would get $20,000 a year on top of that base salary.
Is that given as one check? Is that given as one check every year, or how does that work? They break it up.
It's broken down. It's broken down monthly.
Oh, okay.
At $20,000.
Good.
Coming down to the anesthesiology, the military values critical wartime specialties. I think it's at the top of the list there.
Okay.
Critical wartime specialties are folks that save lives on the battlefield. So your general surgeons or any type of surgeon, your anesthesiologists, your emergency medicine physicians, those come to the top of my mind. So anesthesiology is compensated well, all things considered, with these specialty bonuses. So $60,000 just for being an anesthesiologist in the military. You can see the general surgeons make $52,000. I think neurosurgery, ironically, is same as anesthesia.
$59,000. Yeah.
So you can add that on top of your base pay. We could sit on this chart for a little bit longer because I'm going to go into that far right of the column.
Mm-hmm.
But to add on the rest of those little bonus monies, for once you're board certified, you get an additional $6,000 a year. That's prorated monthly as well. You have your specialty bonus, you have your base salary, and then you have your housing and food stipends.
Gotcha.
If I crunch those numbers for anesthesiologist with my time in service, I would get a gross of about $160,000 a year.
Mm-hmm.
So we just looked at the table for physicians and on the outside,
yep.
and average was double that.
Yep.
What these numbers don't show is the 3 years that I took advantage of the bonus money during residency.
Mm-hmm.
So that was probably about $40,000 or $50,000 a year for 3 years. So there's additional $150,000 that I got before coming on active duty. Alternatively, if you did the HPSP program and they paid for your medical school, that scholarship program covers your tuition and gives you a stipend. So your medical school could have been, whatever Georgetown costs. I have a colleague who went to Georgetown. Extremely expensive.
Yep.
Correct?
Yeah. Total, with housing, tuition, it's about $100,000 per year. So.
Yeah. So the HPSP would have covered at least the tuition part of it.
Yep.
So if you have a family and you're going to Georgetown, you're probably still going to take out some loans to help cover housing expenses. Mm-hmm. But the scholarship covers your tuition and gives you a small housing bonus. So that's kind of a range depending on how expensive your medical school is. Mm-hmm. And that is not reflected in your yearly salary as a physician. Does
Gotcha.
that make sense?
Yep.
So I owe 4 years. So I will make whatever an anesthesiologist makes at 4 years of service. Once you've completed your first obligation, this is when this column on the right, the RB, retention bonus, that's when that comes into play. Mm. So if you go to the retention bonus and go down to anesthesiology, they update these every now and then. The Navy says if you sign on for 4 years, we're going to give you $75,000 a year on top of everything else. Oh. So that $160,000 salary now becomes like $135. I don't usually do math in public or in TV. Whoever 160 is and $75,000. So significant. And that is a lump. I believe that's a lump sum that is paid out.
Gotcha. So that's
every year.
That's $75,000 in addition to this the $59,000 as well.
Correct.
Plus your base salary, BAS, BAH. So 160 plus 75. That's like 230 or so.
235. I just did the math. So that's $235,000, and you now owe 4 years of service. So you make that $235,000 each year, and then as you promote or spend more time in service, your pay would go up as well.
Got you. Okay, so I never knew that. Even being in the military, I only knew that you got a bonus depending on your specialty, but I didn't know the RB rate as well. So for orthopedics, it's $75,000. That's okay. So that makes a little bit more sense now.
Especially that gap.
Yeah, absolutely. Especially not having to worry about paying back your loans, and then in addition, once you deploy or if you deploy to a location, a lot of this money is tax free. Is that correct?
Yes, that is correct.
Got you.
The last kicker that I want to throw in there is something I didn't realize, but you can also calculate this or take into consideration. As military physicians, it depends a lot on where you're practicing. I'm at a large hospital. There's some smaller hospitals. So it's going to affect the acuity of patient that you see, the complexity. So that can affect your choice of practice and how happy you are. But there's also the opportunities to practice in interesting locations like Okinawa. Go to Japan for 3 years and practice, or go to Rota, Spain, or all these locations where you can just have a pretty decent quality of life while making this money guaranteed. Alternatively, if you're in the ideal location where there are moonlighting opportunities, you can also spend time doing moonlighting.
Gotcha.
So, go ahead.
Can you explain what moonlighting is to people out there that may not know what that is?
Yeah, so moonlighting means, I'm employed full-time with the military, but there's a group in town, a hospital that needs help with anesthesia services. So I do have to get permission from the military, but then I go to that group, I can sign a contract with them, and they can pay me either an hourly rate or a stipend or a daily rate to work for them when I'm not engaged in duty for the military. So a lot of times it's weekends, or I take leave or vacation, and I go work somewhere else. So if I were to work weekends, like maybe one weekend a month in the local area, I could probably make an additional $30,000 to $50,000 a year on top of what I already bring in.
Yeah, and then that's kind of closing that gap, even further. And then one another thing that a lot of people don't think about is health insurance. Being in the military, you and your dependents, your family, that health insurance is taken care of. So that's one thing you don't have to worry about. In private practice, that's what I pay for. I have to pay for that myself, versus being in an employed position or working at a academic center where most of your healthcare insurance is provided for you. So, that's another added benefit of being in the military.
Absolutely. And if you have a large family, that's even more of a benefit that you're not paying those healthcare related expenses.
Yeah. For the people out there that are trying to make that decision, whether they're pre-med or in med school, should I go toward the military route and have them pay for my school, or should I, take out all these loans? The average med student takes out $300,000 in loans. What type of advice would you give them to help them make that decision?
For you, I would definitely, or those listeners, I would definitely recommend finding somebody in the military. I'm available if you have questions to answer those questions about what military life is like and how that would apply to you. In this episode or this brief video, we covered a lot of the questions that I personally had, but the caveat is each situation is so incredibly different depending on what specialty you want to go into, what your family situation is, how much your school tuition is, that it's a conversation that we would need to actually have. My inbox is full of people with questions about that, and I do answer and respond to those and try and help guide and mentor and educate others, but it will be a bit of a longer conversation and not just a couple, 4 or 5 exchanged messages. So be prepared to have a 10 to 15 minute, 20 minute conversation, but I am definitely available, as well as probably most positions in the military.
Awesome. And Dr. Bradley, how can you be reached? Where can people find you?
Yeah, so you can find me at my Instagram. I do a lot of my different endeavors on Instagram. So at stevenbradleymd, StevenBradleymd. Additionally, I do have a blog that's stevenbradleymd.com, the Mask Off blog. I actually started it before COVID.
Yeah.
But I will be posting additional blog posts regarding military medicine and different perks and aspects of the career. So go there, and there's a question section where you can email me a question through the website as well.
Excellent. And I kind of knew that you'd be the perfect person for this because I actually read your blog interview on military pay, and I'll put that in the show links as well. But Dr. Bradley, thank you so much for coming on today. Even, being in the military for 8 years, I learned a lot. I didn't know maybe this would have influenced, my decision to go into medicine, especially with everything going on now with COVID. I think that's one of those things you have to think about, which path you're going to take, and hopefully this video helps a lot of people out there. But thank you, Dr. Bradley.
I do have to say one last thing. My views discussed are my own and not those of the Department of Defense or the United States Navy.
Gotcha. I'll put that into the links below. But thank you, Dr. Bradley. I appreciate it. Everyone else, thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.